I've been to Agnes. There you are again. You switched right over, so you get a gold star today. November 1st, there's a Toronto Memory Program. I'm going to get to you in a moment. I just want to welcome everybody to the Women's Alzheimer's Movement account. It's November 1st, which is the beginning of a very important month for the Women's Alzheimer's Movement and so many others who are working to prevent Alzheimer's, solve Alzheimer's, bring us the latest information about Alzheimer's. So we're here today at the Women's Alzheimer's Movement, kicking off Alzheimer's Awareness and Caregiving Month all through November. We're going to begin giving you the latest information about prevention. We're going to be introducing you to top-notch researchers, scientists, and those who are trying to make inroads in this space. And we are continuing to try to answer the question why women are 2/3 of those who get Alzheimer's. That is our focus. That is our mission. In addition to educating you about prevention and lifestyle, we're trying to fund research into answering that question, why women, particularly women of color, are those who get Alzheimer's. So we're going to find it out, even if it takes us another 10 years, which I hope it won't, but it might. But anyway, today we're really excited because we're going to be speaking with Dr. Sharon Cohen, and she's joining us. She's the medical director of the Toronto Memory Program. She's also assistant professor of neurology at the University of Toronto. And we're super excited to kick off this month with her, with all of her knowledge about prevention, about early diagnosis, about clinical trials, you name it, she knows it. And if you have questions for her, I'm going to try to talk and read at the same time. I might have to put on my glasses because I see so many of you joining here, and you all have waves on there, so I'm just going to throw the waves back at you. And I hope you will tell others who perhaps don't know about the Women's Alzheimer's Movement account to follow along, because we post really great tips and tools every single day for people in this space. And our mission is to try to help you and help those that you love get better educated, better empowered, better informed. So that's kind of what we're doing. And I'm going to find her. She's from the Toronto program. Dr. Sharon Cohen is going to kick off our month here at the Women's Alzheimer's Movement. Hi, how are you?
I'm great. Thanks so much for having me on your show. Maria, thank you for what you do.
Oh, thank you so much, Dr. Cohen. I'm really thrilled. I was just saying we're kicking off the whole Alzheimer's Awareness and Caregiving Month with you. So thank you so much. This is a global issue, Alzheimer's caregiving. So I'm glad we're doing it with you in Canada, our neighbor, to tell us what you know, what we should know. And since this is the first day of the month, I just want to begin by asking you what you're excited about in this space. You've been in this space a long time. People come up to me all the time, Dr. Cohen, and say, where's the cure? What's happening? What's new? What's exciting? What are you excited about? And I want to throw that to you. What are you excited about? What's new? What are you hopeful about?
Thank you so much. You are right. This is a nasty disease, and many of us have been working in this space, well, for myself, 30 years, if you can believe that.
Wow.
And, we saw a few symptomatic treatments come in 2000 or so. 1997 was the first one with donepezil, and then a real drought for the last, 15 years or so, no new treatments. But we are excited, we are encouraged. We're on the cusp of a change now where we have the capability of understanding Alzheimer's disease much more profoundly than before, not just relying on symptoms, but actually being able to look at the biology of the brain. So it's not good enough in cancer just to say someone's got a lump and maybe that's cancer. We've been doing that with Alzheimer's. Oh, it's probably Alzheimer's for a long time. We need to, in cancer, do a tissue diagnosis with a biopsy. In Alzheimer's disease, we need to look at spinal fluid or a special scan, a PET scan of the brain, to say, yes, that sticky protein, amyloid, is actually there. And then we can be sure about what we're dealing with. So diagnosis is one thing, but why would you want to diagnose a scary disease without a cure? So I'm excited not only that we have better tools for diagnosis, but that there are some breakthroughs in treatment, and there will be more. So we were at a pivotal moment, really, with the first disease-slowing medicine having been approved by the FDA in June So some of your listeners will have heard about
Right.
aducanumab, but there are more to come. So this is a movement now to diagnose early, to treat early before so much of the brain is ravaged, and not try and play catch up.
Well, let me ask you that though, Dr.
Yeah,
Cohen. You said we're on the cusp of a change. There are more breakthroughs coming. So for people right now who are suspect they may have Alzheimer's or struggling with, maybe MCI, and I want to get to the difference between the two. What's the cusp of the change? We've been hearing the cusp of the change for years, but what does that mean? How do you translate that into real helpful information?
right. So if someone has memory symptoms, maybe they've got risk factors, a family history of Alzheimer's, maybe not, but they're worried something's changed. Not only can we take a history as a physician and do some cognitive testing, but in the past, let's say the cognitive testing was pretty normal, we might say, oh, you're just stressed out, you're too tired,
Yeah.
you're too challenged with looking after your parents, whatever it is. We would kind of uh, negate the fact that there may be a very real change. So now what's different in diagnosis is we can say, well, your cognitive testing is pretty good, but the Alzheimer's process can go on silently in the brain for a while. So
Yeah.
if you are at risk and if you've noticed symptoms, we take that seriously. And then it's all about prevention. So let's see if you could join a prevention study, have a PET scan or a spinal tap, and see if that sticky protein's there. So we're not sending people away now and saying, oh, come back if you're worse, which is a terrible thing to do. We're saying, okay, things look good now, or maybe memory impairment's mild, but you're still functioning well, which would be the mild cognitive impairment scenario. But there are things to do to clarify whether this is Alzheimer's, and also treatments within studies to try.
When people talk about mild cognitive impairment, does that always lead to Alzheimer's, or is that a diagnosis in and of itself and separate?
Right, that's a very good question. So mild cognitive impairment is a phase of Alzheimer's disease, but there are many other causes. So mild cognitive impairment simply means there is cognitive impairment, usually memory, but it could be language, it could be navigation, calculation, other cognitive skills. So it's there. We can measure it on our cognitive tests. But people are still able to manage their usual daily routines. So people may still be working, banking, shopping, traveling, driving, looking after their kids, whatever they do. That's all that mild cognitive impairment means. So then the next question is, what's causing it?
Right.
If it is due to Alzheimer's disease as the underlying cause, then that mild cognitive impairment will over time gradually worsen, and people will progress to the dementia stage of Alzheimer's disease. If the mild cognitive impairment is due to sleep apnea, to a head injury, maybe to a stroke, there are so many different causes, to a brain tumor, then a different treatment is required, and maybe this won't be progressive. Maybe if there is a benign tumor pressing on the memory area, you remove it, you can then maybe not have mild cognitive impairment, and it's not this progressive entity signifying Alzheimer's. So it's all about what's the underlying cause of mild cognitive impairment.
So you also mentioned in there, if you're having some memory issues and you go in and then the doctor says to you, well, look at, you might have mild cognitive impairment, or you might have early onset Alzheimer's, or you might be progressing in that way, join a clinical trial. People are like, I do not want to know whether I have Alzheimer's. I do not want to get this test. I do not want to have a PET scan of my brain because there is no cure. Tell them why they're wrong.
Okay. Well, there are lots of reasons why getting a diagnosis is beneficial. And absolutely nobody wants a scary diagnosis of Alzheimer's disease. I don't like telling my patients that's what they have, and they don't like hearing it. It is a very sad moment. However, knowledge is empowering, and people can plan for the future, and especially if they are early in the process, they can really look at that bucket list, they can look at their finances, they can talk about what they would want for themselves in the future, including whether or not they would want to join a trial. So being able to plan and have more control is really important, especially in a disease that as it progresses will rob you of control and decision making. So it's not like, oh, well, I'll put this off and later I'll be able to say what I want. You might not be able to. There's a couple more reasons why we shouldn't stick our heads in the sand. And one is that it's not just about knowledge and planning for the future, but accessing services. So having a diagnosis is really the gateway to saying, okay, I've got this lousy diagnosis. What can you do for me? Maybe I'll do better if I have meals prepared, or maybe if I join an activity program or work on my lifestyle strategies to promote brain health. And maybe not just cognition will stay stable longer, but maybe my mood and my overall sense of well-being will improve. So that is certainly possible. And that's not what people are thinking about, getting a diagnosis of Alzheimer's, that maybe I'll feel better. But maybe if we look at all the other lifestyle things, you will actually eat better and exercise and feel better. And then finally, you mentioned clinical trials, and absolutely, this is the hope for the future. And when people understand that there isn't a cure for Alzheimer's, but there are lots of promising medicines, and joining a trial is a way to help yourself and your family to get the medical attention in detail that you deserve, but also helping future generations, your kids and grandchildren, and people you don't even know. I mean, it's only a matter of time before we beat this disease, but nothing will happen if we don't have clinical trials.
So one of the things that we at the Women's Alzheimer's Movement, we've talked a lot about trying to get women to join clinical trials, because so often all of these trials were on white men, right? So we're always saying we need women to join, we need people of color to join, right? Because this disease also disproportionately impacts people of color. How do we get people who don't traditionally know about clinical trials, who don't traditionally go to clinical trials? What is the lure to get them? One of the things when I was covering a clinical trial, I was struck by the incredible medical care that the participants were getting. And I always thought, I wonder why they don't promote that more. You get these scans, you get really great medical care, you really have somebody watching you in a much more detailed way than if you were just with your regular doctor.
Yeah, it's true. I mean, you do get very comprehensive care, and overall people in trials, even if they're on placebo, end up doing better than people not in trials because of the extra care and attention and, troubleshooting and problem solving and, making sure that everything's fine-tuned. But women should absolutely feel empowered to say, what about me? And their duty is not just to look after the home and their husbands and their children. They really need to speak up and say, I've noticed some memory problems too. Is there anything that I should be doing? And the responsibility is not just on women themselves, but on healthcare providers to think of women in the forefront. Well, to think of everybody, all backgrounds, all races, as very welcome pioneers in moving the field forward. So I think that the healthcare system needs to do better and is finally recognizing that there is disparity both in race and gender in research in general, and also in the community. People need to be coming forward and say, hey, I'm a woman of color and I want to be in an Alzheimer's trial. I mean, that's a remarkable thing to hear from somebody.
Is there a home base for people to go and try to find out where there might be a trial near them that they can participate in? Because the trials do require a lot of time. They are done over a lot of time. So you have to be in proximity to where a trial is going.
Yes, and that is one of the problems, that it is hard for people to find out where to go for a trial. Their family doctor may not actually know the trial centers, but starting with the family doctor, that's a good place. Where is there a center nearby where there are Alzheimer's trials or people are studying memory? So I would use the family doctor, but also the Alzheimer's Association has a trial match component to their website, so people can get information on a variety of trials and where they're being held and what those trials are about. And you're right, some trials are very demanding in terms of people having to come to a trial site every 2 weeks and maybe have intravenous infusions, but not all. And so finding a trial that fits for you, for the person coming forward, fits with your lifestyle, what is doable and possible, is so important. And fortunately, one of the things that is exciting, of the various things exciting in our field, is there are a lot of trials, there are a lot of different compounds being investigated. They work differently. They're not all intravenous infusions. Some are oral medications. Some of the trials, require intense visits, and others not. And there's a real move now also to try to go to people rather than have people come to research centers. So
Oh,
virtual trial designs are now becoming sort of a hot topic. And can we do virtual assessments and reach out to more people that way, people who wouldn't have a proximity to a research site?
that's exciting. I hadn't heard about virtual trials, but they can't then come and get a PET scan and those things. You have to come to the research center.
Right. So, right, there may be some diagnostics and some things that have to be done outside of the home, but as many procedures or tests or assessments that can be done virtually would be embedded. And that hasn't been the traditional way of doing things. And I think COVID's prompted some of that, but also this recognition of disparity. And we're not reaching out to everybody uniformly. And not everybody can travel a long distance. And what about people in rural areas who don't have access to these, sort of shiny medical centers nearby?
Right.
So there is a real interest in redesigning or rethinking how we design trials so that we can reach more people and make it more convenient.
Several people on here before asked the question that you had mentioned a couple medicines. They have loved ones with Alzheimer's. Aricept is perhaps the best known one, but if you have a loved one who's just been diagnosed, what are the medicines that people should be asking about? What do you feel is the best hope?
Right. So if someone is, so let me just say, in the mild cognitive impairment stage of Alzheimer's disease, so that's sort of the pre-dementia stage, none of the medicines, the traditional medicines, have been approved with that indication. So that is a real barrier that people are being encouraged to get an early diagnosis, and yet there's nothing at the mild cognitive impairment stage. So we'll come back to that because times are changing. But of the Aricept family of drugs that were approved for the dementia stage, there are 3 in the Aricept class. So Aricept is donepezil, that's the non-brand name, and galantamine and rivastigmine are the other 2, and they all have funny names, but
I was just going
they're
to
all
say, wow, I
generic.
wish you're struggling with your memory and the names are impossible to remember.
Yeah, I know. When they were still on patent protection, the brand names were easier, but now they're all off patent, which makes them less expensive, and that's a good thing. They all work fairly similarly and will provide modest benefit to symptoms in about 70% of people who try them. So not everybody with Alzheimer's disease is going to notice benefit, but some people will. And so everybody should have a try of at least one of those medicines. And for
There's
people
a woman here, Shelley, just said, would a doctor tell you if you really have Alzheimer's? I can answer that, Shelley. Yes, doctors do tell you. As Dr. Cohen was just saying, if you have a PET scan or if they can actually see that, they will tell you. It's not like the doctor is lying to you if you have it. And then sometimes it's not clear. You might have, as you were saying, Dr. Cohen, mild cognitive impairment. Talk a minute about, because I think a lot of people don't understand the connection between sleep apnea and mild cognitive impairment. People have struggle with their memories and they don't realize it might be associated with sleep or lack of.
Right. And so, that's a very good example of why someone shouldn't ignore a memory problem, because maybe it's not Alzheimer's disease, but if the tests aren't done, then we won't know. It could be sleep apnea. So when we have sleep apnea, which is a very common condition, there is obstruction to airflow into the lungs when we sleep, and especially in deep sleep. And so what happens is our oxygen level drops and the brain's not getting enough oxygen. And when that happens night after night, it takes a toll particularly on the memory part of the brain, a fancy part called the hippocampus. But this low level of oxygen night after night can really injure that hippocampus. Fortunately, we can diagnose and treat it with CPAP. So it's a device that one wears at night. It can take some getting used to, but in many people, that solves the sleep problem and memory doesn't decline further, and hopefully it rebounds. So very important, because it can be a cause of mild cognitive impairment, but not due to Alzheimer's, or dementia due to sleep apnea. It can be that bad.
Talk a little bit about the new drug that was so controversial with the FDA approval several months ago. that aducanumab, I don't know,
Aducanumab, good.
aducanumab. But that was kind of the view of that was for early stage of Alzheimer's. Is that also for, you said there's nothing for mild cognitive impairment, but if you come in and find out it's not connected to your sleep or you have the beginnings of that, is that drug for you?
So this drug, you're right, it was controversial. It was approved by the FDA in June of this year. It is indicated for mild cognitive impairment. It's the first drug indicated for that, as well as the mild dementia stage of Alzheimer's disease. So it is specifically approved for mild cognitive impairment due to Alzheimer's, so not due to sleep apnea or some other cause of mild cognitive impairment, and mild stage Alzheimer's disease, dementia. And this is very hopeful. Going early is really the key. And if aducanumab, which reduces amyloid in the brain, can slow down the disease at an early stage, when people are still functioning, as I said, with mild cognitive impairment, people are still in the community, they are banking, shopping, traveling, they're contributing to home life, society, maybe working. This is exactly the stage where you want to have a disease-slowing medication. And there will be more disease-slowing medicines in the next few years. They may have more substantial disease-slowing properties. So this is really a turning point. It is important. So for someone with mild cognitive impairment, they definitely should be saying, is it due to Alzheimer's? And if it is, what about aducanumab? Is that right for me? It won't be right for everybody, but it may well be right for a given individual.
So that is kind of in the plus column for early diagnosis. That kind of says, where people say, well, there's nothing, there's nothing for me, there's nothing they can do. I think Dr. Cohen just said that there are a few things there. You can get into a clinical trial. Perhaps this new drug might be for you. It's for that stage, that early stage, not for if you have a loved one who's had Alzheimer's or another dementia for 10 years, it's not for that. But a clinical trial might be good for you there. That drug might be good for you. And also, like, I think kind of you talked about getting your affairs in order, but I've talked to more and more people who've had diagnosis of Alzheimer's who, less they're getting their affairs in order, but they're really living their lives. They're living their lives. They're participating in marathons. They're changing the way they eat. They're changing the way they live, and they're living very full lives. Alzheimer's diagnosis, I'm dead right now. And I think, we've tried to remarket that. There's much
that's fabulous. You are so right. I mean, I was sort of sheepishly saying, can you imagine that people are living better after their diagnosis, because I don't want to be dismissive of sort of rejig your priorities and do things that you've always wanted to do and you love. People can actually feel much better about themselves and have a lot of quality time. If you catch this early, more quality time.
And also the thing that I've noticed in people who are participating in clinical trials, every single one of them, when I've asked them why they did it, they said, or why they put the time in, they said, I want to help somebody else. I look at this as a public service. I look at this as my duty. I look at this as some way that I can give back. These people are really heroic.
Absolutely. We call them medical heroes. I see them every day, and I'm so impressed with their altruism. And they put up with a lot. They give a lot of themselves. And, it's really important for all of us to know that without medical heroes, research participants pioneering with us, we would have no drugs. We would have no drugs for COVID. We would have no drugs for diabetes. The pharmacies would be bare. We wouldn't have antibiotics. I mean, there's no shortcut. Clinical trials are the way new drugs come to the market. And so we need volunteers. We can't do it ourselves. You can have a wonderful drug, but if you don't have an opportunity to test it and make sure it's adequately safe and it does what it says it's going to do, then it doesn't come to the market. So people are wonderful. I'm just inspired by research volunteers.
Thank you so much, Dr. Cohen. I love that line. If we didn't have volunteers, the pharmacy shelves would be bare. I think Absolutely. That's really important to think about. We take so much of what we take for granted, and we don't think about all the people who put their time, their energy, and served so that we can have so many of the drugs that we have today, not just for COVID, but for so many other drugs that we just take without even thinking about how they got there. So remember, everything that you're taking came from somebody giving their time, participating in a trial. And that is the future, as Dr. Cohen said, for Alzheimer's. We've got to get more people into trials. We have to get more women in, more people of color at younger ages. I remember when I started getting involved in Alzheimer's 20 years ago, when my dad was diagnosed, the only people they were looking at were people in their 80s. That's completely changed. The whole landscape is different. And now they're also looking at women. They're looking at people of color, but they can't look unless people sign up, unless people step up and show up. And so I want to thank you so much, Dr. Cohen. You're so great to kick off Alzheimer's Awareness and Caregiving Month with us. I'm glad you're excited and glad you're hopeful.
I am.
And I know that for those of you who out there who have a family member dealing with this right now, you're probably sitting there going, well, like, you know, it's not going to help me. And I get that. I've been where you are. But if we all continue to work, it's going to help maybe your kids or my kids or somebody else that we love. And it can't come soon enough, that I know. And but I think doctors like Dr. Cohen and so many others that stand behind her, alongside of her, are working in labs all around the world trying to figure this out. So we have the best and the brightest devoted to this. We have so many young people going into neuroscience, so many technology people now going in. We can look at different ways now because of technology, right?
Exactly. Yeah, no, it's suddenly become of high interest, and we need that. We don't want Alzheimer's disease to be on the back burner.
No,
Not
for sure.
now.
Well, not if we have anything to do with it. It's going to be front burning. We have the fire up hot, and we are boiling.
You bet.
So thank you so much, Dr. Cohen. Continued work, and thank you for all that you have done in this space, and thank you for joining us at the Women's Alzheimer's Movement today.
Thank you so much. Be well.
Okay.
Take care,
Wonderful.
everyone. Bye-bye.
Okay. Thank you. Thank you so much. So you heard Dr. Cohen say that she is hopeful, that there is hope on the horizon. I know the horizon can seem kind of far off. I get it. I've felt frustrated myself in this space, but we have so many people now looking in areas that they never looked at before. So that's the hopeful thing. If you have somebody in your family who's had a recent diagnosis, please go and find out where there might be a trial near you. You get incredible medical care, and you know, it might help. That's the good news. And I hope you will continue to follow the Women's Alzheimer's Movement here on WHAM. We also have a weekly that comes out every Tuesday. You can go on the Women's Alzheimer's Movement and sign up for the WHAM Weekly. It gives you the latest news, everything that's cutting edge. It gives you information about prevention, food, caregiving. It covers everything that we can on a weekly basis. It's a great little email newsletter. So I hope you think about subscribing to that. It's free, so no excuse. Anyway, so thank you so much. And to all of you who are out there caregiving in this space, we applaud you, we see you, we honor you, and we know the work you are doing on a day-to-day basis is life-changing and life-saving. So thank you all. I see Shelley. I lost my dad in April of this year to Alzheimer's, and now my uncle has it, my dad's brother. So Shelley, if you stay with the Women's Alzheimer's Movement, they'll give you information, and I hope you'll feel like you're a part of a community by joining that organization and that community. LTG Malone, I cared for my mom 24/7. Oh yeah, we have an upcoming summit, November 18th, on the power of research. You can go on to the Women's Alzheimer's Movement and register for that. It's kind of brings you up to date with the latest research. We'll be talking to researchers everywhere. And so that's really an incredible summit. We do great summits there at the Women's Alzheimer's Movement. They're free. They're sponsored by companies, but you get to come on and listen to all the latest and the greatest. And I'm going to be moderating that. There's all kinds of other people on it. Michelle and Mel, I lost my husband's mother and my grandmother. So there's a lot of you sharing your stories and sharing your firsthand experience with this disease. Also, we're going to be Veronica Beard. So anybody who wears those clothes, people are telling me, they're kicking off sales for the Women's Alzheimer's Movement tomorrow. So if you like to shop, or if you need to get a Christmas present, or you need to buy something to go to a party, go to Veronica Beard tomorrow all across the country. And part of what they sell tomorrow will go to the Women's Alzheimer's Movement. Gosh, I just told you a lot of things. I told you about shopping. I told you about the weekly. I told you about the summit. What else didn't I tell you about? I don't know. But there'll be something more I can tell you about. And obviously, we depend on donations, so you can do that too. $5, $10. We fund research, and we fund seed research at the Women's Alzheimer's Movement, and then they go and get big NIH grants. But I think that's enough for today. Thank you all so much for joining us, and thank you, Dr. Cohen, for her expertise and her insight, her enthusiasm, and her hope. So thank you all. Have a great rest of your day. Can you please pin it? Shelly, I don't know how to, mosh bars. Yeah, I forgot about mosh bars. Yeah, you can eat mosh bars. I don't know how to pin it, but somebody will pin it, and we'll figure that out. Okay. Okay, bye.